Hi, today we are joined by Dr. Mayank Mittal. He's a Beacon Medical Group interventional cardiologist, and he's here to explain why we have moved to urgent and emergent surgeries only at this time. Dr. Mittal?
Well, thank you, Heidi, for that question. And I think these are tough times. I would like to remind everybody that we're in the middle of a pandemic. And what that does to us is instead of practicing clinical medicine, a lot of us, like one of my colleagues mentioned, are practicing pandemic medicine. And one of the important aspects for doing any procedure that we do is obtaining a consent, a valid, informed consent. And in that discussion, when I propose a procedure to some of my patients, I would always include a discussion about the risk of the procedure, the benefits of the procedure, and most importantly, the alternatives to the procedure that I'm proposing. And if you throw in COVID and this pandemic in that mix, I think the risk and benefit are always there for the procedure, but the alternatives become so much more valuable. Is there something else you could do? And the reason why Beacon as a healthcare system has moved away from doing elective procedures because our healthcare system is burdened, it's stretched. We're all working very hard. Kudos goes out to all the healthcare workers, nurses, our hospital workers who are working day and night to provide essential healthcare services, to emergency patients, to patients who require that right now. So could we all come together as a community and perhaps delay some of the non-essential or maybe elective procedures that could wait for the next few months without actually causing any harm? And that requires patients and providers to have an engaging discussion. Do you need this procedure right now? Because you have to think about is every time somebody comes in for an elective procedure, there are several things that are happening. Number one, that person may be bringing in infection knowingly or unknowingly to the healthcare setting. Not only they're exposing other people in the hospital, but they're also exposing vital healthcare staff to coronavirus. And I'm sure you have heard in the news, there's a lot of shortage of healthcare staff. We are part of this community. We are getting sick. We are getting exposed from patients, not only in the hospital, but when we go to pick up our own groceries. And despite all the efforts that we're doing, the community spread is rampant. It's spreading very widely, and it is affecting healthcare staff and puts a tremendous strain on healthcare resources. The second thing elective procedures do is it takes away the personal protective equipment and direct it towards these elective procedures when they may be needed for somebody who's having a heart attack, somebody who's having a stroke, people who cannot wait. They need the healthcare right now to help them. I think the biggest message I would like to give to all the patients is make sure you're discussing with your provider. Do you need this procedure? Is this a routine procedure, which is what a normal layman term would be for an elective procedure? I don't think anybody in their right mind is trying to cancel any procedure that is needed right now. We're still here. We are here 24/7 helping patients in Beacon. In fact, we are working beyond our capacities to help the patients that need us. All we are urging is that we have this discussion. Do we need to do this right now, or can it wait?
Such an important message. So let's talk now a little bit more specifically to your group of patients, cardiac patients. What are we doing to keep them safe at this time?
I think there are several measures that various providers involved in Beacon Health System and cardiologists, such as myself, are taking care of. The measures that we have taken to help our patients to reduce their risk of exposures. We are testing. Each patient that comes in gets tested for COVID if we can. If they are emergencies, then we do a rapid testing to help protect ourselves and help protect our patients who are in the vicinity of this patient. The second thing we're doing is beyond choosing is this an elective procedure or not, informing and keeping our patients informed of their healthcare needs. And if there are alternatives, Beacon has the CT-FFR, which is a completely viable alternative to doing a coronary angiography and requires a CT scan as opposed to exposing multiple staff members. It does not require admission to the hospital. Their length of stay in the hospital is tremendously reduced. So, when I used to do the cath before, we would do the cath. Well, if somebody needs a stent, we'll watch them overnight. I often find myself asking that question, now, do you really need to be in the hospital overnight? We will discharge them after a few hours of observation if it's safe for them. Yesterday, I saw a 91-year-old lady who needed a valve replacement, and typically I would move very efficiently in getting that valve replaced as soon as possible. But when I had the discussion with her yesterday night, I told her, I was like, right now, you are better off staying away from the hospital, because one thing is very clear: heart patients or patients who have pre-existing medical conditions are at a higher risk of having complications from coronavirus. So not only we are watching for you, but we don't want you to contract coronavirus while you're in the hospital or suffer the side effect of complicated medical stays. Certainly, if it could be avoided. If you have an emergency and you need help, then we want to make sure we have all the resources available, not only just the PPE, but also the staff to serve you in times of need.